Next speaker is Dr. SHEBA Susan Das.
Good afternoon, everyone. Presenting a comparative study of the post-operative complications after small incision cataract surgery in diabetic and non-diabetic patients. Our study was aimed to compare the post-operative complications after small incision cataract surgery in diabetic and non-diabetic patients in a tertiary care center in South Kerala. The study was an observational analytical study which was conducted in the Department of Ophthalmology, Dr. SMCSA Medical College Hospital, Karakonam from December 2022 to October 2023. The study included two groups. The group 1 was patients with type 2 diabetes mellitus undergoing manual small incision cataract surgery. Group 2, patients without type 2 diabetes mellitus undergoing manual small incision cataract surgery. The group 1 included cataract patients with type 2 diabetes mellitus between 40 to 85 year age group attending the ophthalmology OPD and willing to participate in the study, and excluded patients with other ocular pathologies that may affect the postoperative visual acuity, example glaucomatous optic neuropathy, corneal pathologies, retinal pathologies apart from diabetic retinopathy, patients who have undergone other ocular surgeries, patients with traumatic or complicated cataract, and patients with type 1 diabetes mellitus were excluded. Similarly, in group 2, cataract patients without diabetes mellitus between 40 to 85 year age group attending the ophthalmology OPD and willing to participate in the study, and excluded patients with other ocular pathologies that may affect the postoperative visual acuity and who have undergone other ocular surgeries and those with traumatic or complicated cataract. So, our study included total 102 participants, 51 participants in each group. After doing a detailed history and vision assessment, anterior segment evaluation was done, dilated fundus examination was done, and after doing relevant investigations, uncomplicated manual small incision cataract surgery was done. Postoperatively, patients were managed with antibiotics and steroid eye drops as per standard protocol, and patients were discharged on the first postoperative day. And they were followed up in OPD on 1st, 3rd and 6th post-op weeks, and in each visit recorded the visual acuity, clinical examination findings and complications. All the data were collected in the Microsoft Excel sheet, and analysis was done using SPSS software version 21. Analysis was done using chi-square test, and p-value less than 0.05 is considered statistically significant. Coming to the result, in our study, majority of the patients in both the groups belonged to the 56 to 70 year age groups. Males were more than females in our study, and majority of them had immature cataract. Coming to the comparison of postoperative complications in each follow-up. In the first week follow-up visit, we found that 30 patients in the diabetic group and 15 patients in the non-diabetic group were found to have complications, and this was statistically significant. In the third week follow-up, 21 patients in the diabetic group and 10 patients in the non-diabetic group were found to have complication. This was also statistically significant. In the 6-week follow-up, 15 patients in the diabetic group and 7 patients in the non-diabetic group were found to have complication, and this was not statistically significant. And the complications we noted include corneal edema, striate keratopathy, uveitis, pigment dispersion in IOL, and hyphema. And in the first week follow-up, 9 patients in the diabetic group had uveitis, and 4 patients in the non-diabetic group had uveitis, whereas 8 patients in the diabetic group had pigment dispersion and 5 patients in the non-diabetic group had pigment dispersion in IOL. And in the 3 weeks follow-up, the most common complication noted in both the group was pigment dispersion. And in 6-week follow-up, only minimal complication was noted. Pigment dispersion was seen in both groups, and 4 cases of uveitis were seen in diabetic group and 1 case of uveitis was seen in non-diabetic group. Corneal edema was seen in a case of diabetic group. So coming to the discussion part, a similar study was done by Singh et al., which was a prospective study done among 150 diabetic and 150 non-diabetic patients to evaluate the visual outcome and postoperative complications after cataract surgery, and the complications were more commonly noted in diabetics. Similar study, prospective study was done by Bhaskar et al. Among 200 diabetic and 200 non-diabetic patients. In their study, in 10 days follow-up, striate keratopathy was the most common complication followed by pigment dispersion. Whereas in our study, in diabetic group, pigment dispersion, uveitis followed by pigment dispersion was noted. And in non-diabetic group, pigment dispersion more than uveitis. Similar study done by Kaken et al., which was a prospective comparative study, which included 60 diabetic and 60 non-diabetic patients, and complications noted include iritis, corneal edema, and pigment dispersion. Similar pattern was noted in our study also. And the study was done by Anupama et al., which was a comparative study to evaluate the postoperative visual outcome and complications. The corneal edema, striate keratopathy, and pigment dispersion were more in diabetic group. Similar pattern was seen in our study also. So to conclude, according to this observational study, postoperative complications are significantly more in diabetics than in non-diabetics. The major limitation was small sample size, and this was a single center based study. These are my references. Thank you.
Thank you, Ma. Your study is on diabetic and non-diabetic.
Yes.
Nowhere in the study I see the duration of diabetes, good sugar, blood sugar or HbA, because it's a study.
Yes.
You have not mentioned, that also makes a difference. You have shown iritis, you have shown some things which can, pre-op and post-op also. So that will be one of the important factors I would look for in this. I hope you follow.
Okay,
Okay.
sir. Yes. Thank you, sir.
See, it's a known fact that diabetes are more prone for infections. What do you want to tell us, that you have to do surgery for non-diabetics or not?
Sir?
Is it diabetics patients can undergo surgery or not? That's what I want to know.
Sure, they can undergo surgery, but we have to take more precautions while doing the preoperative and intraoperative workup.
That is, strict control should be there.
Yes, strict sugar control should be there.
Okay. Because one slide I've seen, diabetics for 30 number, whereas non-diabetic only 41. The gap is only hardly 11. Not a much a drastic difference there.
Okay. Maybe because of the small sample size.